Welcome back to the Lisa Valentine Clark Show. Do you know what your blood type is? Do you know how high your cholesterol is? Well, according to Women's Health magazine, most adults get blood work done every 1 to 5 years. But what do all those numbers mean? Because as we grow older, there are problems that can crop up, and we should be thoughtful in our health. So today we're talking with the very experienced and helpful Dr. John Putuli, who we will learn about blood work from. Welcome, doctor. How often do you advise people get their blood work done?
It depends on the condition, what you're looking for. If you are in good health, once a year should be enough.
Mm-hmm.
If, on the other hand, you have a particular reason, whether you are anemic, whether you have high cholesterol, whether you have high triglyceride, high blood sugar, then your doctor may advise you to do more often, once every 6 months, or even once every 3 months if you are on diabetic medications.
And what are the basic things that a normal blood work reports on?
It reports on the red blood and our oxygen carrying capacity and our immune system. That is the red blood cells, hemoglobin, hematocrit, white blood cells, and different types of white blood cells, some fighting infection, some responsible for immune regulation and prevention. That is one category.
Mm-hmm.
The second will be our different types of fat in the blood, triglycerides, high cholesterol. Let me make a point here regarding triglyceride. Most people don't think about triglyceride, what it is. Everybody knows about cholesterol.
Yeah, exactly.
The triglyceride is what is called, just like the name means, tri means three,
mm-hmm.
three molecules of fatty acids connected with one molecule of glycerol. This is the name for the normal fat we store in the body.
Mm-hmm.
And if you eat more than what your body can use before the next meal, your liver has to convert the excess, whether it comes into the body as glucose or fatty acid or amino acid, into long-term storage form, that is triglyceride or fat.
Oh.
And that is how you gain weight. The more triglyceride you have in your body, the more weight you gain.
Yeah, that's the stuff we want to get rid of.
Correct. It is an interesting thing to think about. Where does that go? The liver makes it, but the liver cannot store it. The liver sends it to the fat cell.
Yeah.
And you inherit a certain amount of fat cell. In other words, your fat storage capacity is limited by your genes that you inherit.
Oh.
So your parents give you the fat storage capacity, just like you go to a store and buy a particular refrigerator with a specific cubic feet capacity.
Mm-hmm.
Your capacity to store fat is limited by the gene. You inherit one gene from your father, one from the mother for the same fat storage capacity. However, only one of them can be active. So if your mother is lean and if that gene is active, you are going to have very little fat storage capacity. If your father is heavy and if that is a gene active in you, you can look heavy, but because you have large storage capacity, the fat may stay in the fat cell rather than in the blood. I don't know whether you follow what I'm saying. What I'm saying is, if you have inherited a 5-pound fat storage capacity, once that storage capacity is filled up, the triglyceride level in your blood will start going up.
Oh, I see, because there's nowhere else for it to go.
Correct. Whereas if you have inherited a 20-pound storage capacity, then you may gain 20 pounds, but your blood triglyceride may be normal.
Okay, so when we look at these levels of the triglycerides in our blood, what should we be concerned with?
Every year, if that keeps going up, you are getting a sign that your fat storage capacity is being filled up.
Okay, so if it's a high level in your blood, then you are over capacity. You need to really be careful.
Right. So then the question is, why should you be careful? If the fat storage capacity is filled up, your triglyceride going up, two things can happen.
Mm-hmm.
One, fat sticks to the arterial wall. For example, if you put oil, fat is similar to oil. If you put oil on your skin, it sticks. Water cannot move it out or wash it off.
Right.
So if the fat sticks inside the blood vessel, it can block the blood vessel, and you're setting yourself for a heart attack or stroke or damage.
Wow. So who is most at risk? Are thin people more at risk for heart attack?
Well, yes, the risk is not because the way you look. You may look heavy or you may look even obese, but if your fat is stored outside the blood, you are much safer than a thin person with a small storage capacity who is accumulating the triglyceride or fat inside the blood.
Wow, I didn't know this. This means that blood work is important because you're checking for these warning signs for heart attack and heart disease.
Correct.
Is it important?
And not only that,
yeah, go on.
Not only that, when the triglyceride level goes up high, the liver senses that there is no point in converting excess glucose that you absorbed after a meal into fat, because fat can clog up your arteries.
Right.
So the liver will leave glucose as is in the blood. Then your blood sugar start going up. What do you call that person?
Diabetic or pre-diabetic.
Correct.
Okay.
Correct. So the diabetes comes not because there is something wrong with your pancreas or insulin, as we are led to believe by experts, but in my opinion, type 2 diabetes comes from you filling up the fat storage capacity too early. This explains why a pregnant woman who has never had diabetes before or no family history suddenly develops gestational diabetes at 8 weeks of pregnancy because she has been eating for 2 people.
Right.
Everybody encourages her to eat. Oh, eat this. This is good for the child's complexion. This is good for the brain. This is good for this and that. And she eats. And she eats. And she fills up her fat storage capacity. And the liver leaves the glucose because there is no place to store the fat. She is a diabetic or gestational diabetes. After delivery, when she loses weight, fat storage capacity is restored. She can put the fat back in there, and the blood sugar comes down to normal.
If you're just joining us, this is the Lisa Valentine Clark Show, and we're talking with Dr. John Putuli about blood work and what it means when we go and get our blood work done. And we've been talking about different things that your doctor may test for, including triglycerides and fat and glucose that is in your blood. I'm also wondering, why is it important to know your actual blood type?
Well, the blood type is important only if you have a condition where you need to have blood transfusion. Otherwise, by itself, it is not that critical. But if you are in an accident, if you need surgery, if you need blood, then you need to know the exact blood type. Otherwise, your own immune system can attack the blood that you are receiving, and you can have immune-related problems.
What is the biggest question we should be asking ourselves about our numbers when we have our blood tested?
Well, that depends on whether you are looking for prevention or whether you are being treated. For example, let us say you are a diabetic. You take a shot of insulin, and your blood sugar goes down. It does not go out of the body. It is taken out of the blood. It goes out of the blood, but does not go out of the body. This is why even if you keep the A1C below 7 using insulin, you can still have the same complications as anybody else with type 2 diabetes.
Oh, okay.
Now, let's look at cholesterol. You have got good cholesterol and bad cholesterol. With the good cholesterol, in my opinion, I have been searching for it, does not do any good. We were told when we were in the medical school that the good cholesterol will go and pick up the bad cholesterol, which is stuck to the arterial wall, and bring it back to the liver. That is why it is supposedly good cholesterol.
Right.
But cholesterol is just a molecule. If bad cholesterol is stuck, let's say we have a stick-on paper on the desk, and if you put another stick-on paper on top of it, how can the second one pull the first one off the table? It does not have the energy or cannot have energy to pull it off. Similarly, the high or the good cholesterol, it's called HDL.
Mm-hmm.
It's a molecule. It cannot produce energy. Only cells can produce energy. So, in other words, good cholesterol cannot remove the bad cholesterol which is stuck inside the arterial wall.
Right. So the good cholesterol can't get rid of the bad cholesterol.
Correct.
It's just there.
It is there. It is. So why is it called good? Only because it does not do any harm. But to me, that's not enough to say you are good.
Right.
But you have to be doing.
To put a value on it, a moral value on it. Well, what blood tests are important to really scrutinize and look at carefully the most?
Every test is important depending on the context. If you are having an infection, yes, the white cell count becomes important.
Sure.
If you are suspecting anemia, the hemoglobin and the red cell count become important. If you have a family history of blockage or heart attack, the cholesterol number become important. If you have a history of diabetes, even before the blood sugar level goes up, keep an eye on the triglyceride because that goes up higher weeks, months, or years before the blood sugar goes up. So if you want to prevent type 2 diabetes, keep track of your triglyceride numbers.
Okay, and look at those numbers if that is a particular concern. Well, when do we know if we're going to need medication for some of these conditions that we're testing in our blood?
As far as possible, except for infection. Type 2 diabetes and things like that, it is what is called a lifestyle condition. That means you should be able to control it without medication.
Okay.
If you have to look at high blood sugar, if you are looking at high blood sugar, you have two options. One is you can hide the numbers or drive the sugar out of the blood by taking a medication such as insulin, or not put into your mouth the very food that is absorbed into the blood as glucose. And that is increased intake of grains and grain flour products.
Okay,
right?
Grains and grain flour product.
Right. 60 years ago, we had the Green Revolution. That made grain flour products and foods cheaper for everybody in the world. In my opinion, nature never meant grains for humans. Otherwise, we would have had beaks.
I didn't think of it that way.
Yeah. And we cannot digest the chaff of the grain. It has to be milled. It has to be refined. And every government subsidizes grain farming. 50 or 60 years ago, only 35% or less of our daily energy came from grains. Now, in developed countries, it is 50% or above, and in developing countries, it is 70% of daily food energy.
Wow.
This is a common factor all over the world where type 2 diabetes is increasing, and the next epidemic is going to be cancer if we continue the same trend.
So we really need to be vigilant about watching our health and how we do it. Well, we are out of time, but thank you so much, Dr. John Putilli, the author of Diabetes, The Real Cause and the Right Cure. You've practiced medicine for over 30 years, and we're so grateful that you could share your perspective with us and your research. Thank you.
Thanks for having me.